Hey everybody, Dr. Tam here. So a lot of you might wonder, how am I supposed to know if this is going to work for me, right? How do I know if this treatment has worked for me? We've had a lot of patients that came in who've gone to other doctors, whether it is acupuncturists, chiropractors, medical doctors, neurologists, and for years, the reason why people end up with chronic pain is because for years, they end up with pain still. And it's no better than where they were. So a lot of people end up giving up, right? I mean, I understand that. For me, my mom, back in 2002, she had chronic pain. She had something called trigeminal neuralgia, which is pain shooting down the face. And it feels like someone taking a needle and stabbing your face for about 50 to 100 times a minute. And how do you know? How do you know if the next doctor was gonna help? We didn't. And to be quite honest, we were just hoping that they can help us, right? When we went to the doctors, they gave her pain medication after pain medication, cortisone shots, Botox shots around the head and the neck and the face, and it did nothing. They might give her relief for a week or two. Our hopes are up the first few days, and then by the second and third week, it's as if nothing happened. And worse yet, sometimes the pain came back even worse than where it was. I mean, it's just not something that I would want people to experience. And finally, a holistic natural doctor, a chiropractor, helped my mom. In 2004, for the first time, she had relief. And within 8 weeks, she was over 50% better than where she were before. And mind you, the most relief that she's ever had with Botox, cortisone shots, medications were about 3 weeks, right? And this doctor gave her continuous relief for 8 weeks in. And did we know going in, when I was driving from Davis to Oakland to Belmont, right? For those of you who don't know, that's a easily 2-hour drive. And did we know that it was gonna help? We didn't. We hope it was gonna help, right? And when for us, we were at really our wit's end with pain. And there's a reason why they call trigeminal neuralgia the suicidal disease. And that's because people are in so much pain that a lot of people end up committing suicide, unfortunately. And thank God that did not happen to my mom, right? But for those of you out there who are looking to get help, you might ask, well, Dr. Tam, how do I know if this is gonna help me? You might ask my assistant on the phone, how do I know if this is gonna work? The question really to the answer is, you don't. You don't. And the only thing I can promise you is not whether or not it's gonna work, is that we gave it our best shot and that we will give it our best shot to, number one, diagnose the true problem, okay, that you are dealing with. Where is it coming from? That I will promise you, that we will do our absolute very best to diagnose what the problem actually is. It's not gonna be the solution to chronic pain is not a drug, it's not antibiotics, it's not a shot, and it's not surgery, okay? Because the problem still exists after all those things. You ask around, how many people do you know who've had knee surgery, shoulder surgery, back surgery, neck surgery, right? Who's had cortisone shots? Maybe you have taken multiple medications and they're still in chronic pain years down the line. That's because the problem never got fixed. It was never diagnosed to begin with, and it was never fixed, right? So that's what our promise is to you. When you give our office a call, my assistants will get information from you and schedule you an appointment. Now, that first appointment, don't expect to be treated usually on the first appointment because we need to find out what the real problem is. When you come in, we sit down for a consultation, we take you through an exam, possibly x-rays if necessary, and if you've had prior injuries. Now injuries, most people think of injuries like broken bones, surgery, and they say, oh, I've never had that. Well, what about the falls that you've had? What about the accidents, the fender benders that you've had? What about sports injuries that you've had? Okay, it could have been any of those things that's causing you the chronic pain, and be able to diagnose where exactly is that problem in your body is the key, all right? I would say that part of our diagnosis is the information you give us during the consultation. Right afterwards, myself, nurse practitioners, will then do our own diligence, our own physical exam to find out where are you losing function, right? Are you not able to reach all the way up? Is your neck able to only turn one side really well, but not the other side? It's locking up, right? Is your lower back able to bend one way further than the other? We need to see where the lack of motion, lack of function actually is. Then lastly, if necessary, we will take x-rays. We have our own state-of-the-art x-ray machine in our office, hospital grade. We don't have to send you out somewhere to get imaging. We have it right here, right? Your appointment is going to be about an hour and a half, okay? But at the end of that hour and a half, we would have gathered all the information. Now, do I get patients that come in and say, Dr. Tam, I want to get adjusted right away. I want that trigger point injection right away. I want the regenerative medicine. Whatever you've got, fix me right away. Yeah, people come in all the time. Those of you who are in chronic pain, who've been in pain for so long, of course you're gonna wanna get fixed as soon as possible. Now, mind you, that is also my goal, is to help you as soon as possible. But in order to help you correctly, we have to do the right diagnostics. Think about it. If you've got smoke coming out of your car's engine, right? And you take it into a mechanic, would you rather have the mechanic grab wrenches and tools right away and start wrenching on your car? Or would you rather have them do a diagnosis, a diagnostic test to see exactly where the problem is? I hope you chose the latter, right? They got to do a diagnostic test first. So why is it that it makes sense for them to do a diagnostic test on your car, but yet when it comes to something way more complicated, like your body, you think we should just go in and just start wrenching right away? It doesn't make sense, does it? So that's my promise to you, is that we will do the best that we can to figure out what the real problem is of your chronic pain. Quite frankly, that's what we specialize in, is chronic pain. Neck, back, and joint pain, whether it's shoulders, hips, and knees. And really, that's what I specialize in. We've built our whole office to specialize in chronic pain, okay? So going back to, will it work? We don't know. We don't know until we find out what the real problem is. My hope is those of you who are out there suffering from chronic pain, contact our office right away. Let's find out if we can help. I'm not promising you that we can help you, but I promise that we will do the best in our ability to find out if we can. Have a great day.